Now we will talk about how many and how the arches of the foot are classified. There are 3 arches in the foot: the medial longitudinal arch, the lateral longitudinal arch, and the transverse arch. These 2 arches are also classified as longitudinal arches, which are seen on the medial and lateral aspect of the foot, while the transverse arch runs across the foot, connecting the medial and lateral longitudinal arches. The anterior transverse arch and the posterior transverse arch are the 2 transverse arches of the foot. Let's look at these arches closely one by one, starting with the medial longitudinal arch. As the name suggests, this arch is seen on the medial aspect of the foot. It is considered as a big arc of a small circle with more bones and more joints. This arch is considerably higher, more mobile, and more resilient than the lateral. As mentioned before, the arches of foot are mainly made up of the bones among other structures. So, the bones that are part of the medial longitudinal arch are calcaneus, talus, navicular, all 3 cuneiform bones, and first, second, and third metatarsals. We will learn about these arches of foot in terms of ends, summits, and pillars. When referring to the arches of the foot, ends usually refers to the points where the arch begins and ends, such as the heel and the ball of the foot. Summit refers to the highest point of the arch, which is typically located in the middle of the foot. Pillars can refer to the bony structures that form the sides of the arch, such as the heel bone, calcaneus, and the heads of the metatarsal bones in the forefoot. Together, the pillars, ends, and summit of the arches help distribute weight and provide stability and shock absorption for the foot during movement. Let's look at the ends, summits, and pillars of the medial longitudinal arch. Ends. The anterior end is formed by the heads of the first, second, and third metatarsals. The phalanges do not take part in forming the arches. As for the posterior end of this medial longitudinal arch, it is formed by the medial tubercle of the calcaneum. The keystone is the talus. Next up is the summit of the arch. The summit of the arch is formed by the superior articular surface of the body of the talus. Pillars. The anterior pillar is long and weak. It is formed by the talus, the navicular, the 3 cuneiform bones, and the first 3 metatarsal bones. The posterior pillar is short and strong. It is formed by the medial part of the calcaneus. Main joint. The main joint of the arch is the talocalcaneonavicular joint. That is all about the key constituents of the medial arch of the foot. We will talk about how this arch is maintained later. First, let's look at the lateral longitudinal arch. This arch is characteristically low, with fewer bones and fewer joints, and has limited mobility, and is built to transmit weight and thrust to the ground. This is in contrast to the medial longitudinal arch, which acts as a shock absorber. It is considered as a small arc of a big circle. So, the bones that are part of the lateral longitudinal arch are calcaneus, cuboid, and fourth, fifth metatarsals. The constitution of the lateral longitudinal arch is as follows. Ends of lateral longitudinal arch. The anterior end of the arch is formed by the heads of the fourth and fifth metatarsal bones. The posterior end is formed by the lateral tubercle of the calcaneum. The keystone is the cuboid. As for the summit lies at the level of the articular facets on the superior surface of the calcaneum at the level of the subtalar joint. Pillars. The anterior pillar is long and weak. It is formed by the cuboid bone and by the fourth and fifth metatarsals. The posterior pillar is short and strong. It is formed by the lateral half of the calcaneus. As for the main joint of lateral longitudinal arch, it is the calcaneo-cuboid joint. That is all about the key constituents of the lateral arch of the foot. Let's look at the transverse arch of foot. The transverse arch runs across the foot, connecting the medial and lateral longitudinal arches and providing stability and support to the foot. The transverse arch of the foot is highest in a coronal plane that cuts through the head of the talus and disappears near the heads of the metatarsals, where these bones are held together by the deep transverse metatarsal ligaments. The foot has two transverse arches, the anterior transverse arch and the posterior transverse arch. The anterior transverse arch is formed by the heads of the 5 metatarsal bones, with the first and fifth metatarsals forming the two ends of the arch that come into contact with the ground. The posterior transverse arch, on the other hand, is formed by the greater parts of the tarsus and the bases of the metatarsals. This arch is incomplete because only the lateral end comes in contact with the ground, resulting in a half-dome shape. The other half of the dome is formed by the corresponding arch of the opposite foot. Together, these arches help distribute weight and provide stability to the foot during movement. That is all about the key constituents of the arches of foot. Next up, we will discuss the factors that maintain these arches.
Have you ever heard of video books? sqadia.com is delighted to present video books, medical books that have been tailored into a series of videos. sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.